Good afternoon. I'm Dr. Tom Gilson. I'm the medical examiner for Cuyahoga County. I'm also the director of our crime laboratory. I'd like to welcome you to the medical examiner's office. I certainly am happy to see so many people here because this is a topic that certainly has generated more attention to this office than I certainly would ever have cared to see. We came out of 2016 with about 610 people who died of drug-related deaths in our county alone. That's a staggering number, and I've been here in Cuyahoga County for just shy of 6 years, and that number goes up to about 2,000 over my watch. That's a very, very staggering number. Primarily what we saw in 2016 was an increase in the number of deaths related to fentanyl. Prior to that, we were seeing a lot of trouble with heroin, and what we are here to talk about today actually are prescription opioids, which may seem like we've passed by that phase, but that's not true. Most of the people who are addicted to heroin now in this country went through a gateway of prescription pain medication, and it's still a very relevant topic. And last fall, the CDC published guidelines about responsible prescribing for opioids because it's critically important that we cut this off at that level. If we don't create a population of people who are addicted to pain medication, they won't need to seek out illicit substances further down the road. I can give you numbers, and those are certainly staggering. We had more deaths in the month of February, overdose drug-related deaths, at 61 than we ever did in any month. And as you know as well as I do, February is the shortest month of the year. It wasn't that we had to go way back into our history to see when we broke that record. That was in September of 2016. We have a new record for the most overdose deaths in the first quarter of this year. We broke the record that we set in the last quarter of last year. It's not a problem that we are necessarily getting ahead of, though I think we have efforts going in the right direction. This is one of them, and I think the education with regard to the dangers of prescription opiates can't be overstated. This is the pathway through which a lot of people wind up addicted to drugs that we see them come to this office for now. I'd be very remiss if I didn't take this opportunity to thank the wonderful staff I get to oversee in this office, who have really shouldered up, I think, under a tremendously increased workload. I'd also be remiss if I didn't acknowledge partners and people who work in the community, several of whom I've had the honor to stand on stage with. And I told her I'd give her an acknowledgement. Julie from Cornerstone of Hope is another really great partner, and a lot of people in the community who have really, donated their time and their treasure to try to help people who have survived losing a loved one from this. And you'll hear from Greg McNeil later, who was also in that boat, and it's not a particularly nice club to belong to. The last person I really need to express my thanks to is our next speaker, who is our county executive, Armond Budish, who's really been very supportive of this office and really, a good partner in recognizing what a crisis we're dealing with. So with nothing further, I'll turn that over to Mr. Budish. Thank you.
Good afternoon, everybody. As we get started, I'd like to acknowledge the people and the organizations who have so generously contributed time, money, and resources to this incredible effort, and many of them are here tonight, this afternoon, and I'll refer to a number of them. Opioid overdoses are a huge public health crisis. According to the CDC, nationally, more people have died from drug overdoses than gun homicides, which is also a crisis, and car crashes combined. In Cuyahoga County, we're attacking this crisis in many different ways. First, we're increasing the number of treatment beds with the city, the county, and the Adams Board working together on that effort. Second is law enforcement, primarily working with the U.S. Attorney's Office and the Medical Examiner's Office leading the way. And third is public education, making sure that our children and their parents, the adults in the community, have the information they need to truly understand the risks associated with opioids. To better educate the public, the Opioid Marketing Task Force has put together a significant public information campaign. This campaign is truly a community-wide effort. The public information that we're going to be putting out will be running across almost all media in town. Cleveland.com created and is hosting an online resource guide. All local broadcast stations and Fox Sports are running PSAs, and later on we'll run television ads. Our radio partners are running PSAs. Lamar has donated digital billboards. Plain Dealer and Scene are running print ads. The Downtown Cleveland Alliance and the Greater Cleveland Regional Transit Authority are providing outdoor and bus signage. In addition, starting now, you'll see significant multimedia editorial coverage with all of our partners participating. Every TV station will be running a half-hour special tomorrow night, and we'll be encouraging people to call into an Idea Stream call center, which is being staffed by the Adams Board as well as by doctors and specialists from our local hospitals. Our hospitals are also providing support. Both Metro Health and St. Vincent's have generously provided funding for some production elements of the campaign, and all of the area hospitals are supporting us in messaging and in providing educational materials for their patients. So there are many partners making this possible. While the opioid crisis is national, I don't believe that any other community in the country has put together a collaborative effort like this one. In fact, we're already getting, it hasn't even gone up yet, and we're getting inquiries from other places around the country, and I believe we're making this all available to cities across the country. So let me just talk about some of the partners that have been so helpful in putting this together. A donor agency, I want to give special thanks to that agency. They've worked tirelessly and creatively to make this campaign come alive. They have really been the creative key to all of this, and I really express my appreciation. Also, Global Prairie is providing our social media support. Our media partners, WKYC, WOIO, WEWS, Fox 8, Fox Sports Ohio, WVIC are all contributing. Plain Dealer and Scene, Cleveland.com, Lamar Advertising, Radio, WTAM, WCPN, CBS Radio Cleveland, Radio 1, iHeartMedia, and WAKR are all contributing. Sports partners, the Cleveland Cavaliers, are supporting this effort, and we're very hopeful that our other sports teams too will join this effort. Government and community groups have been very supportive. Certainly the county government and the city of Cleveland have been two leaders in this effort. The Mayors and Managers Organization, the Group Plan Commission, the Downtown Cleveland Alliance, the Greater Cleveland RTA, and the Adams Board all have been supportive of these efforts. Our hospitals, Metro Health, St. Vincent's, University Hospitals, and Cleveland Clinic. We have faith-based partners, and one of the leaders is the Greater Than Heroin Collaborative, made up of faith leaders from around the community. Our production partners, HKM Direct Marketing Communications, HP Manufacturing, and David Kroblet have all been supportive. And I really want to give special thanks to the County Chief Communications Officer, Eliza Wing, and standing next to her, her partner in this effort, Rita Andelson, the Director of Communications for Metro Health System. They've put in, I can't tell you how many hundreds of hours the two of them have devoted to bringing this all together. Any of you who have worked with all these partners know it takes a lot of work, and they have done that. This collaboration covers the entire community and many different organizations and areas. In the midst of this opioid crisis, Cuyahoga County is already considered a national model in fighting the epidemic. Our opioid task force recently received the Attorney General's Award, which is the highest honor given by the Justice Department. But despite that, there is so much more to do, and that's why we're undertaking these efforts. As Dr. Gilson mentioned, 3 out of 4 new heroin users have abused prescription opioids prior to using heroin. That's a staggering statistic. And that's why we want to put an emphasis on helping people understand the risks involved with opioid prescriptions. I mean, people think often when you have a prescription, there's no problem. That is not the case. Not enough people are making that connection to the chain reaction that prescription opioids can cause. Not only can they lead to addiction themselves, but they also lead to overdose doses of heroin, fentanyl, and now fentanyl-laced cocaine. So our new public information campaign directly addresses this lack of understanding in the community. And as I've said repeatedly, we're working with a lot of great partners in this effort. The City of Cleveland has been a great partner in this and many other of the efforts that we're undertaking. And at this time, I'd like to ask Mayor Jackson to come forward.
Good afternoon. I want to recognize Mayor Prosnick from the Mayors and Managers Association. He's, as the county executive mentioned, they're one of the supporters of this initiative, but he is here today representing the organization, and they're made up of Democrats and Republicans, so this doesn't matter about who, there's no respect of person or ideology in regards to this addiction. As Dr. Gilson mentioned, we can give the data. And give you an example, in the first quarter of this year, there's been around 400 overdoses in Cleveland, of which I think around 60-something resulted in death. And when you compare that to last year, you're talking about double what happened last year at the same time. And so if we're going to make an impact, it has to be in several steps. And the first step is about prevention and education, because the more we're able to prevent and educate people so that we can prevent, the better off we'll be. It's difficult to measure what you prevent, but we know that if we help somebody on the front end, they will have, we will have, they will have a different experience if in fact compared to if they had got addicted to heroin, cocaine, and one other thing in terms of risk and just being informed, people should know, particularly young people, that there's no purity of drugs anymore. That if you're doing heroin, you're doing cocaine, marijuana, you have to assume that some of opioids is associated with that, and which makes it deadly. So everything that we've done in Cleveland, and I know this holds true for all communities, everything that we've done and we've been successful at is because we've done it as a community. And we've collaborated and we've partnered with each other with one goal in mind, and that is to accomplish what it is that we set out to accomplish. Today is about prevention, and as we move forward, it'll be about other things, and I know the county executive and the doctor will be talking about those things as we go forward. One of the major partners who deal with the crisis of addiction and overdose and the effects of it is Metro Health. So I want to introduce Dr. Budish, who will talk.
Good afternoon, everybody. First, I wish we weren't here. I wish that we didn't have to do this and we did not have the devastation that is afflicting our community. But the county executive and the mayor are right. This brilliant campaign would have never happened without collaboration. Dozens of people who don't normally work together, who sometimes compete with each other, coming together for the greater good. What this group has done in a matter of months is utterly remarkable. With virtually no budget, they'll be saving lives. Maybe the life of someone you know or love for years to come. This, to me, is what Cleveland is all about. This campaign stops an epidemic in the best place to stop, where it starts. It reminds us of that beautiful quote from an author anthropologist, Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. People have changed the world for me in understanding the opioid crisis. I'd like to recognize our Dr. Joan Papp, who is the founder of Project Dawn in Cuyahoga County. Due to her efforts, we estimate that the death rate has been cut by 50%. And Rita Andelson, who has always kept me focused on getting this done. So, I guess I'd like to say that the thoughtful, committed citizens who are meant to change the world is truly the only way that that gets done. I'd like to introduce Dr. David Pearce, who is the CEO of St. Vincent Charity Hospital.
Just got a message just as you finished up, so perfect timing. Hello, everybody. I'm Dr. David Pearce, representing St. Vincent Charity Hospital and president of said institution. St. Vincent Charity has served this community for greater than 150 years. And for the past 65 years, it has served the needs of the chemically-dependent, a mission of the Sisters of Charity of St. Augustine. Until quite recently, St. Vincent Charity Medical Center's Rosary Hall has provided the only hospital-based inpatient opioid treatment access in Northeast Ohio, providing, on most recent measure, 16% of the state's inpatient opiate discharges. 5 years ago, Rosary Hall was admitting 4 to 5 opioid patients per week. Now we admit 4 to 5 per day. Hence, St. Vincent's is pleased to support the Know the Risk campaign. We also know that far too many of us are in need of treatment now. 1 in 10 adults suffer addiction. That is 1 in 5 households. This is a contributory factor for 70% of domestic violence cases and 80 to 85% of child abuse and child neglect cases in our region. St. Vincent Charity Medical Center is prepared to increase its treatment services. Number 1, by expanding our partial hospitalization program to a 6-day-a-week program. And secondly, to provide transportation services for residents of sober living houses to be delivered to our hospital to engage them into our intensive outpatient programs and our partial hospitalization programs. This will provide care to an additional 300 patients per year. It is our hope to further enhance our treatment capability by providing centralized sober living and residential beds on or near our campus, creating a centralized function. In closing, we wish to create a comprehensive care continuum to help more individuals achieve long-term sobriety. St. Vincent Charity Medical Center is prepared to serve this effort. We, however, are unable to do this alone. We need the support of our community, providers, government, partner agencies, and individuals. We know that in order to have a community-wide impact, we need to rally together against this epidemic. It is our hope that St. Vincent's, with assistance, may achieve our treatment goals. Thank you. I'd now like to introduce Christine Merritt.
Thank you, Doctor. I am here on behalf of the media organizations that are involved in this effort. Know Your Risk represents a unique collaboration among Cleveland area media outlets. Television and radio stations, billboard, print, digital, and online entities all have committed to donate inventory and space to promote the Know Your Risks campaign and produce extensive news coverage. That coverage will include a half-hour special tomorrow night at 7 p.m., which will be aired on 4 television stations here in Cleveland, each producing its own program. Additionally, a live phone bank will be hosted at Idea Stream tomorrow evening from 5 to 11:30 p.m. The creative for the campaign and the social media strategy were developed and executed pro bono by 2 local agencies. The social media portion has already kicked off, and soon you'll hear radio spots and see television PSAs, as well as billboard and print ads throughout the Cleveland area. This collaboration among Cleveland area media outlets is unprecedented and reflects a commitment to addressing a huge issue in our community. Media outlets are not just covering the story, they are advocating for the community and working together to leverage their platforms and their extensive reach to get the word out and put a stop to this community crisis. We're proud to be part of this effort and appreciate the leadership of the county and the city and all of the partners involved. And now I'd like to introduce Greg McNeil, founder of the nonprofit foundation Cover 2 Resources.
Good afternoon. It's a pleasure to be here this afternoon, although this is a role that I'd rather not be in. On October 23rd, 2015, my family was feeling pretty good about things. While my son had struggled with opioid dependence dating back to 2007, and it was a prescription actually that was filled in the ER that he ended up getting hooked after, and getting hooked on, I mean to say. And ultimately, in 2010, that led to full-blown heroin addiction. When we discovered it, we went directly into crisis mode. We figured it out, got him what we felt like was the help that he needed here locally. He did well. But after getting out of the program, about 6 months later, he relapsed. We decided that it didn't work locally, not knowing that relapse is part of recovery. We thought it was failure. We sent him to Florida. In Florida, he went through a program, came out. After 6 months, he stumbled again. And then magically, in the summer of 2015, everything seemed to come together in his life. He had a great job. They loved him. He was the star sales guy. And he fell in love with a beautiful, loving, very spiritual woman. On October 23rd, Sam and his girlfriend, Dinasha, were expecting their first baby. Sam kissed Dinasha goodbye that morning. It was a Friday morning, and she went off to a church retreat. Sam went to work midday. He pulled his boss aside and said, I'm feeling real good. Do you mind if I take the afternoon off? And his boss said, sure, Sam. Go ahead. We'll see you Monday. Well, at 12:30 that afternoon, temptation got to him, and he sent a text to his guy, who hooked him up. The last text that he received was 6:30 that night from that same guy saying, yo, you good. The next day they found him in his apartment, alone, was gone. Sam died of a heroin overdose, and it was heavily laced with fentanyl. And my family was blindsided by that because we felt as though we had it covered. But needless to say, we didn't. It's only since that time that we've learned there's so much that a family needs to know about this disease that we didn't know at the time. So we established Cover 2 Resources with the mission to help educate and advocate for families with loved ones that are struggling with with opioid dependence. Our first initiative has been a series of podcasts. We call them the Cover 2 PPT podcasts. That's people, places, and things that are making a difference in the opioid epidemic. We've got about 85 of them out there now. And one of the things that we feel strongly about is education is one of the key pillars to this thing, to getting out in front of it. And Know the Risks, this campaign that the team here has developed, is an unbelievable campaign. It smacks you right in the face and wakes you up in terms of the risks of opioids. I don't know, had that been available back when Sam was first prescribed in 2007, I don't know if that would have made a difference for us and woke us up. But I do know one thing. This campaign is going to save lives. This campaign is going to change the outcome for some families. This campaign is going to make a difference in some families' lives. And I'm really pleased to be here talking about it today. There's two other things I want to mention. Number one, there's programs that are working and working well throughout our country. And I just want to name a few of them. Quick response teams. Some of you have probably heard about those. We found that in Coleraine, Ohio, and it's made a difference there. It's a unique approach. We're bringing it to Northeast Ohio, and I think it'll make a big difference here. We've already started 10 of them in Northeast Ohio. Another program is Drug-Free Clubs of America. Again, this is a prevention program, and we believe that it has a lot of power, a heck of a lot of power. There's one more that I've yet to explore or get started, if you will, back here, but I think it has great promise. And it has to do with prescribing practices. And it's based in the ER. Basically what it comes down to is it's a whole set of protocols to instruct all attending physicians in so that they can use opioids as the absolute last resort in prescribing practices in the ER. Now this is a very successful program in Paterson, New Jersey, and I hope that we can bring it back here. So, but I want to close with one point, and I think that it's probably the most profound point here in terms of making a difference in the opioid epidemic. I spoke with Sam Quinones, the author of the best-selling book Dreamland, a few weeks ago in preparation for a program. He's coming to Northeast Ohio, in fact, next week on the 12th of April for a whole day of events. But what he talked about, what he shared was, with all that he's learned in researching that book that profiles the opioid epidemic and how we got into this mess, what he shared was that he said, Greg, it's not going to be federal government coming in to swoop in and solve this problem. It's not going to be state government. It's going to be local leaders. It's going to be leaders in our community. It's going to be the leaders, many of which are in this room, that are going to make the difference. We've got some great leaders here in Northeast Ohio, and I couldn't be more proud to be associated with many of the people that are in this room. So thank you all.